step A, when the patient reports the injury to work, a lot of times they'll come in, they'll say, yeah, I told my manager that this injury happened. If they don't sign something, is it actually on file, or is that sufficient if they just tell their manager?
Kind of yes and no. It's insufficient in my mind because I want a piece of paper that says, here's what happened, here's the moment it happened, I reported it immediately, there's no suggestion that something happened outside of work and I'm trying to get it covered. Here are the witnesses to it, here's witness statements. They put all that in there. And it makes our case a lot easier so there's not later on an issue of them saying, we don't even know where this really happened, if it's, say, a traumatic injury. Even if it's an occupational injury, as soon as they reasonably know it, it's important to tell the employer. 2 reasons. One is that it makes it easier to prove the claim actually existed. The other one is if you don't give notice to the employer within 30 days, and they don't have notice. So if it turns out we can prove that the supervisor says, oh yeah, he told me, then there was actual notice, even though there wasn't a written form. But if they assert that there wasn't actual notice within 30 days, it shortens their statute of limitations substantially. And so to 2 years, from 12 down to 2. So then it's really important that they're aware of that and they're not sitting on a claim longer than they have because they didn't make a report of injury.
So then it'd be worthwhile if a patient comes in and says, I've only just told my employer
to
have them get the forms.
Yeah, and it doesn't necessarily have to be that they fill out a form, but you want some sort of objective information that somebody can look at and say, yeah, they knew. If they send them an email, if they're the kind of people who converse in email, just sending them a thing saying, by the way, and we do this at my office. We had a secretary that actually slipped off her chair, and we said, it's probably going to be nothing, but we'll just send an email saying, Rebecca slipped off her chair today, and we don't think it's anything, but we're just noting it in case anything comes up. And just having some kind of a record that's kind of indisputable that notice was given is helpful.
Every company has a little bit different process for that. For example, Monroe Clinic has Verge. So anytime something happens, you want to report it in Verge, that automatically comes to us, and we report that out. So that's our system. So a lot of companies have a different process for that. So it might not be just a traditional, here's a first reported incident report. So that's something you want to think about.
Yeah, and that's a good point, that a lot of times companies have a system and they'll discipline if you don't follow the system. So employees get disciplined for failing to report using the thing. So, and a lot of times employees just don't know what the system is. You don't get hurt every day. So you've worked there 20 years and all of a sudden you get hurt. You might not realize that there's a reporting system in place. So it's always a good idea to ask, do you want me to put this in writing? But to ask in a way that even if they don't have a reporting system, that you've made note of it. And it's always a good idea, if you don't do it by email, to keep a copy for yourself. Was that helpful? Okay.
And then clarification on 7A again.
Yeah.
So let's say that the patient never takes time off of work. They're seeing you after work in fast care or ER. Are you still supposed to say the date of injury? I'm assuming is whatever the patient says the date of the injury is?
What you can do is, we turn in 16B forms all the time that are incomplete because there's just some information doesn't exist yet. So you might be completing a 16B form where there's not a date of injury yet. But what you can do is leave the date of injury blank and just write in the description of what the employee says happened. And later on, as the case proceeds, the different medical opinions, because there will probably, if it turns out to be something, there will probably be an opinion later on after they've actually missed work, and then we'll have a date of injury that will apply to it. And your form will stay the same without a date of injury, but they'll know what it is because it'll have the same description of events. After the end of healing is when we traditionally rate permanent partial disability, and it's paid according to the disability schedule, which we saw in attachment B. Then they file a hearing application. They can file an application for hearing anytime it's been denied. Judges hate to have 2 hearings. So if they have 1 hearing on causation early on, and then you reach an end of healing and they have to have a separate hearing on disability, they don't like that. They're overworked. It takes years to get a work comp claim through. They're so backed up. I have a case scheduled for trial April 1st that we filed the hearing application at the very beginning of 2018. So it takes a really long time to get these things scheduled, and they don't want to have multiple ones. They're really backed up over there. So we normally wait to file the hearing application until after they're done healing. It annoys our clients, your patients. You'll hear them say, I don't have a hearing yet, but that's why. We have to try and get all the information together. Unless it's going to be a long time. If it's going to take them a year to heal, then we might get it. Or if they need an order from a judge to get a surgery paid for, then we might do a hearing application well before an end of healing, just so that they can get covered. We file the hearing application. They have this form called a COR, Certificate of Readiness. And then that's a point at which we'll start talking either settlement or a trial. I would say 80–90% of work comp claims settle. And the reason they do is that it's different from a personal injury. We can calculate down to the penny what the value of a work comp claim is. I can say, based on my medical opinions in the case, the value is 32,843 cents, and theirs can be, worst case scenario, $5,000, and we can say, well, if these are the outer limits, if your worst case, my best case, and we can figure out kind of what the probability is, because it's such a narrow area of cases that it's not hard to predict which way a judge will go. And so the vast majority of cases do settle, but they tend to settle on the eve of hearing. It's not usually until within 15 days of hearing, after all exhibits are filed, that cases settle. So we get ready for hearing, but they do usually settle. After a settlement, judge issues an order, and after the order, again, ongoing medical treatment may continue. And now we are to the magical 16B form. I'm going to pull this up. So if you want to turn to attachment A, has everybody seen one of these before? Okay. So I want to go over kind of box by box what you can expect here and what they're actually asking for, because sometimes it's not as plain as it seems. The top part, boxes 1, 2, and 3, should be completed by the employee or their representative. You don't need to, and if they're not completely completed, so if you have somebody who's not represented by counsel, they might just bring in one, and they might just have their name and address on it, and a lot of the other stuff might not be there. Don't worry about that. As long as you have their information and you can describe the exposure that they allege, that's going to be sufficient for the time being. Eventually, they're going to have to get that filled out completely, but you don't need to worry about that. Box 4 describes, it says, to describe the accidental event or work exposure to which the patient attributes his or her condition. One issue that we see a lot is doctors that say, well, I don't know that that happened. I wasn't there. I wasn't a witness. You're not describing what actually happened. What you're describing is what the patient has told you happened. So it's the exposure to which the patient attributes her condition. Putting down what the patient attributes does not make you a liar if it turns out that we later find out that didn't happen. You're just putting down what they say happened. So if it's occupational, the best thing to do is to have a description of what their job duties are. If you say work as a carpenter, it's not as useful as saying daily use of a hammer and saw, heavy lifting of materials. So what you need is kind of the specific activities that would have given rise to it. But if it's a traumatic event, the more detail you can provide based on what they've given you, the better, because the one thing that gets an opinion kind of tossed out as not credible or useful most often is that they'll say, well, actually, they didn't really know what the person did. They say daily activities. How do we know that that doctor knew what daily activities, that, this guy comes to hearing and he testifies that he did A, B, C, and D, but we don't know that the doctor knew all of those things when he wrote this. It's possible that the doctor believed he also did X, Y, and Z, which the patient isn't going to testify to at hearing, but the doctor's opinion was based on that. So it's really important that you put down which activities you're basing your opinion on, or which events you're basing your opinion on. Box 5 asks for a complete description of the disability and diagnosis. And they say a copy of the history containing this will suffice. If you want to include medical notes, best practice is to attach them and to say see attached. If you just say see notes, and lots of people like to say see notes, we don't know what notes. I mean, we have boxes of medical records. And we have boxes of just your medical records. It might be this. And so we don't know which note. If you want to say, see restrictions from May 15, 2019, that's useful, because that's a specific note we can look at. But the best practice is to get somebody to print out that specific note and attach it and just say see attached. And then it becomes incorporated as part of this. Or an even better practice, if possible, is to actually write, you know, whatever was in that note. If it's, I mean, if it's paragraphs long, you don't need to redo it. But if it's just saying, you know, the diagnosis is compression of the L4-5 and you know, need for laminectomy, you need to put down exactly what the diagnosis is. 6, 7, 8, I kind of block together because they go together, and that involves specifically 6 and 7, your treatment of them. So did you treat it? Obviously, it's always going to be yes, and the date of the last examination. Date disability began from work is asking about the time that temporary disability began. So this isn't the date of permanent disability. They're asking when did they first start missing work. Box 9 and 10 are far more important. 6, 7, 8, sometimes those get left blank and the world doesn't end. But 9 and 10, 9 is their temporary limitations and when they began. And sometimes you're going to have, you know, several of them. You know, for this period of time, the restrictions were this. For this period of time, it's that. And it's important to kind of put down what the restrictions are and what the period of time is, especially if they weren't taking return to work slips that identified that, because that will substantiate their need to be off work during the healing process. Box 10 is really asking, so they say the date the injured, date injured was or will be able to return to full-time work, subject only to permanent limitations, state any permanent limitations. So they're asking when they're going to have permanent limitations. What they really mean is what is their end of healing or maximum medical improvement. So the department created this form, often not using the actual language of the statutes, but when they're looking at it and in practice, what they're looking for is their end of healing date. And box 10 is really important because that is a turning point in the person's case. When they reach their end of healing, they're not getting any more time off work paid. Even if they miss time off work, and even if everybody agrees it's due to the injury, none of it's paid. So you want to be clear that they're actually done healing, first of all. To me, I always want to make sure that they aren't having continuing improvement treatment in physical therapy and they're off work for it, because that should be paid. But if they're just having maintenance and all they have is permanent restrictions, that's an end of healing, maximum medical improvement, put that date down. And as far as stating the limitations, you can put them here, but you can also put them in box 16, which is going to ask for permanent limitations as well. And you don't really have to repeat it twice.
But this is a form typically that starts early in the process, is that right?
It gets used more than once in the process. A lot of times we'll have a 16B form completed by a doctor kind of near the beginning to get benefits covered, and again at the end to assess disability. We always have to have one at the end if there's any permanency, because that's the only way to get permanency.
And do you find, again, I don't think we in this organization are, there's no billing going on when you do these. I mean, is this something we can bill for or charge the insurance company or?
You can. I think there is billing that goes on. It's not as awful as the billing up at some of the Madison practitioners. I mean, when I started doing this, everybody charged $50 for these. And we do our best to fill out as much as we can. If I'm involved, I'll fill in box 4 for you, because it's what does the patient allege, so I'll fill it in for you. And if that's not what you understand, you can cross it out and change anything. And we'll fill in the date last treated as we know it. We'll do as much as we can so that it's a quick and easy form for you. But we have a couple of doctors in Madison that charge $500 to fill out this 2-page form.
So is our organization
Better? Yes.
Is a bill being generated, certainly not from us? I'm just curious about how the process. I mean, is Monroe Clinic billing for these?
They are.
Okay.
We go through, it used to be, starts with the T. It's an unusual name, not Tanya. Tana Klopfenstein. And now it's, I think, primarily Peggy Gobley. And we do get bills, and actually the patient pays for it. We don't pay for it, but the patient pays for the cost of that. And if you're asked to provide one by the insurance carrier, by golly, charge. But you know, and if you're asked to meet with them, I think that's something that you can charge for as well. That's a meeting. But I think often it's not, but you absolutely can charge for the 16B. Usually what happens is there's one charge if it's just completing the 2-page form. If you're doing a narrative report, usually there's a more substantial charge then. So 11, 12, and 13 are kind of a big section. This is the causation section. And it's a little bit confusing because it's kind of an either or and. So 11 and 12, 11 is asking if it caused it directly, and 12 is asking if it didn't cause it directly, did it cause it by precipitation or aggravation of a pre-existing condition, which is also covered. Both of those are covered, but normally you're going to have yes in one and no in the other. It doesn't really make sense that you'll have directly and by aggravation. So it's one or the other. And then 13 is asking about occupational claims. So what they're saying is if the patient suffers from a condition caused by an appreciable period of workplace exposure, and that was either the sole cause or at least a material contributory causative factor. And that's an important phrase in work comp because a lot of people think that the work injury has to be the factor, but it really has to just be a factor as long as it's a contributory causative factor. So it can't be kind of a almost minimal nothing factor. It has to actually be contributory and causal. But if it is a contributory causal factor, it is a work injury, even if there are other factors that are covered, or other factors that contributed to it. So you have a genetic predisposition, you farm on the side and lift heavy things there, you hunt and hear loud noises and that contributed to your hearing loss, but you also work in a noisy environment. It doesn't matter if there's also other factors, if it is a factor.
Good question. On box 11 and 12,
Yeah.
would you potentially say yes to both of those if they had multiple injuries, let's say? They aggravated a shoulder injury and then also had loss of a finger or something?
Sure. In that case, the best practice would be to have two 16B forms, one for each injury, and so to opine separately on the finger and on that. If it, let's say that all happened in one incident, you know, they got knocked around and they twisted their neck and cut off their finger. You could put it in there, but it's just a matter of describing which is which. So, you know, neck injury direct, this indirect, you know, you can do it, but I think it's always more clear if you're willing to complete two, if you do two separate ones. 14, 15, and 16, I'm putting them kind of all together. That's another section that, in practice, we look at those three boxes together. So, has it resulted in permanent disability? And 15 is, if so, what's that disability? And for that, we're going to talk about this just a bit here. If you look at, is it C? So if you look at the administrative code, so we have statutes and then the administrative code. And the administrative code for work comp gives minimums for certain procedures. And I've attached it so you can take a look at ones that might apply to your practice. Those are procedure minimums. Those are if you have a good result. Those are not, this procedure gets this amount. That's, if it turns out beautifully and perfectly, they get that amount. If it's a less than perfect result, they just, for whatever reason, have some loss of motion, they have, continued loss of functioning, you're to rate upward. And if you look at the bottom of attachment C, you'll see under permanent disabilities, the disabilities set forth are minimums. However, findings of additional disabling elements shall result in higher than the minimum. The minimum assumes that the person was previously without disability, and a reduction shall be made for pre-existing disability. So you kind of want to look at all of that. It gets a little complicated because a new change to the statute in the last few years requires that you also allocate the disability that's related to the injury. So when you complete box 15, you're going to want to say what the percentage of disability is, to what body part, and when you rate to the more proximal distal further in body part. So if the injury is to here, you're going to rate it as compared to amputation of the shoulder, not to the elbow. So you go to the above the joint that has the rating. And when you do it, you have to now allocate what part is due to the work exposure and what part is due to other factors. This is a brand new change. A lot of people aren't doing it, and they've been kind of lax on it, but I'm seeing more people, more insurance carriers giving pushback if there's not a rating that says this percent is due to the work and this is due to pre-existing disability or to outside of work exposure. And so you have to allocate that, and that would go in box 15. And if it's all due to the work injury, then you should just say 10% disability to the shoulder, entirely due to the work injury. You just want to be absolutely clear that there's nothing else to allocate. And then box 16, we talked about that at box 10. They're talking about elements of disability. So that can be the permanent restrictions there. But you can also include things, not just restrictions, but also limitations. So put what the restrictions are, and then their limitations might be different and additional. So, lack of range of motion, they might have deformity, weakness, pain, lack of endurance, or components of illness. Any of those that you considered in making your assessment, you should identify, because it helps the judge understand how you arrived at the number you arrived at. Unfortunately, workers' comp doesn't follow the same system as personal injury. We don't have kind of the same schedule that personal injury claims use in assessing disability. We have, here is the body part, here are the procedure minimums, and you just give us your ballpark, and based on, essentially it's supposed to represent a loss of function. We say, if you lose your shoulder, if you lose your arm at the shoulder, you have amputation, there's, that's worth losing half your body, because it's 500 units as opposed to death being 1,000 units. So 500 units right there. And so what we're saying is you've lost half of your bodily function, essentially, if you lose an arm. And if you lose two, you've lost 1,000, so 100%. But we're looking at kind of the total loss of use. And the whole kind of overarching idea in work comp is it's supposed to really reflect the loss of the ability to work. It's that everything's supposed to sort of tie back in some way to the ability of somebody to function as a worker. So when you're giving an assessment, and it's hard, you're kind of pulling a number out, but the procedure minimums give some guidance as to kind of what's normal and accepted. And then judges just always look at what they've given in the past for similar type injuries. They can take your opinion and they can vary it, their decision by up or down 5%. So if you say 10%, or let's say you say 30% disability and an IME says 10%, well then they can give anywhere from 5 to 15 if they accept the IME's opinion, or from 25 to 35 if they accept your opinion. The middle, they can't just split the difference, but they can accept your opinion and then issue an order 5% up or down. So that's kind of the practical application of how your disability assessment works once we get to a hearing on the matter. The 17 is the prognosis. That doesn't matter so much. It's usually good, fair, or guarded. And then 18 really is important, and it often gets overlooked. Future treatment. When we go to a hearing, we often want to ask for what's called an interlocutory order. It's an order that allows for future coverage. And to get that, we have to have an opinion saying that future treatment is necessary. So if they're going to need annual checkups for this forever, or if they're going to need occasional physical therapy as indicated by pain in the patient or something, it needs to be indicated there, otherwise it's going to be a brand new fight and workers' comp will not cover it. And then prior to this accident, did the employee have any disability? This kind of goes back to question 15, which requires you to assess the disability that is due to the injury and the disability that may be pre-existing. A concern is when you put it in both, that they'll say, 10% due to the injury and an additional 15% total, 10% to the injury and 5% pre-existing. And then if you say, did they have, or 5% other, let's say, and then down in 19, if you say 5% pre-existing, they'll deduct that 5% twice. So if you put something in 19 and you've already addressed it in 15, just make absolutely clear that it's the same 5% that's the pre-existing, and 5% as described in box 15, because they'll deduct it twice. Or in box 15, make sure that the 5% that you say, this is as a result of pre-existing, instead of just other, because they may say, well, that's for some not pre-existing but out of work or something. So you kind of want to be really clear, so there's no confusion with that. And then you have to sign the certification that you swear, subject to imprisonment, that it's true with your findings and diagnosis and opinion. And that's it. Yes?
Two quick questions. The big, long, onerous form that we get, how long can they sit, how long can they stand?
Mm-hmm.
Consistently, we get them mailed, and it's like this perception, and I know that's my perception of a perception, that these are things we can just come out of the air
Yeah.
without the patient there. And I think it would be very helpful if maybe counseling your clients that when they get those forms, they need to make an appointment. Because I
Okay.
think there's definitely this feeling that this is something we can fill out in 10 minutes between patients, and there's no way we know how long they can sit or stand without work hardening or a functional capacity exam.
Yeah, yeah.
So the other part of that is the system of gradations as far as the examples you gave. Is that an effort to get away from functional capacity exams, to replace them?
I don't think so. The department loves functional capacity exams. Our clients hate them because if they have a work injury, work comp will not pay for the FCE. They're very expensive, and our clients pay them out of pocket, and they're usually off work when it's happening.
They're a
And
couple thousand.
Yeah, they're very expensive, and the people who get injured the most tend to be low wage workers, and then they're looking at paying that out of pocket. So we don't love them, but we also recognize their usefulness in really knowing what what it is. Even the insurance carrier, even if it ends up, some insurance carriers will cover treatment in the absence after there's been a work comp denial. They also don't cover FCEs very often because they see it as a component of litigation and not really for treatment. If you can put in there that this FCE is truly for treatment, because in my mind it is. I mean, they can't know what their limitations are, and they need to know that, not just for litigation, but so they know how to behave in their life.
They are so helpful, and
Yeah.
those folks that do them are, they give you so much information, are they malingering, all these things. It's very difficult.
They can test for effort, and they're great. I love having them. They're just hard to get covered. But if they're for treatment as opposed to for litigation, so if you can really emphasize that this is necessary to let the person know what their limitations are, and so they can behave accordingly, sometimes they'll be covered that way. And then they can get it, and then you can have the information you need to really accurately complete those forms. And in the end, we do need to have a doctor complete the forms. MD, DO, chiropractor, psychologist, psychiatrist can complete them, but advanced practice nurse practitioners cannot complete they can fill it out kind of for treatment, but it can't be used as medical causation.
How about residents?
That's a good question. I've never had that come up, and I don't actually know the answer. But if it comes up, give me a call and I'll look into it. Yes?
Just to clarify on the WP16 forms, you said that the provider needs to be filling those out. Our current practices, whether I should say this out loud or not, is actually that our LPNs or RNs are completing them and then the doctor is signing them after.
That is fine. I mean,
That's so perfect.
everybody does that because it takes time to review the file, get the information, and you don't have in your head every piece of information for every patient. That's fine, but the doctor has to have done some due diligence to be able to actually swear that the information here is accurate.
Sure, okay. Just
Yeah.
want to clarify, this is a new process we're moving forward with, and want to make sure we're doing that appropriately as we put that out kind of facility-wise.
Yeah, no, I think it's a good process, and a lot of places have kind of a centralized work comp thing. Sometimes it's just one office that kind of, if there's a need for a 16B, you send all the patient file, and they look through it and try and figure out what the answers are and send it to the doctor with the information that they can then make any adjustments if necessary, and that's fine. Yeah.
And when you said small farms are exempt, how many employees are you talking?
Well, I don't have it off the top of my head. It's a certain number of employees. I think they have to have 6 employees on at least, it's maybe 20 calendar days per year. So it's on a calendar year basis. If you want to email me, I can give you the exact amount. But that comes up a lot around here.
Yeah.
And if they're not covered as employees, then they're not covered under the Workers' Compensation Act. So it's not like, oh, this farmer didn't have the insurance he should have had. They're just not covered. Then they can bring a claim under